PowerPoint presentation is part 2 of Unit 3, Awareness of Protection and Safeguarding in Health and Social Care, Adults and Children and Young People, Early Years and Childcare. It's part of the Level 1 certificate of the Introduction to Health, Social Care and Children and Young People settings. The aims and objectives of this session are by the end of the session, you will be able to describe the boundaries of confidentiality and when to share information. You will be able to explain who is responsible for protecting vulnerable adults and safeguarding children, and you will be able to identify sources of support and information in relation to protection and safeguarding. You will be using your workbook to answer the questions, and it's important that you look out for the green box on each of the slides, usually on the right hand side, to show you which question the slide relates to. It's important that you do share your own ideas when you're working through the PowerPoints. You can use the ideas, but expand, put them in your own words. They're here to guide with pointers, but sharing your own ideas, it demonstrates a more and stronger understanding of the content. And if you do wish to progress to the next level, it shows you're able to do wider reading and have an understanding of a topic that's up for the discussion. Now, before we look at this session, I just want to just talk a little bit about safeguarding. I understand that safeguarding is not the nicest subject for us to be looking at. And, you know, some of you may have your own experiences, hands-on experiences. And so it's important that if you need to take maybe a little time away, you know, pause the video, take a little time out, because it's, as I say, you know, it can be upsetting when you're thinking of, when you are looking at these different areas. Here at Plato Training, we have a safeguarding officer. So if there are anything that you want to discuss when you start looking through this session, anything that you want to discuss further, you know, please just contact your tutor, and they can, you know, they'll be able to help, support. Maybe you could discuss with our safeguarding officer or put you in the direction of some support, other agencies that might be able to help you. But, you know, we do understand that it's not the nicest thing to be looking at. But as I said, it's important because it's going to be our responsibility when we're working in the care environment to protect the people that we're caring for. Okay, so we're going to start by looking at confidentiality and the boundaries of confidentiality. And you'll see this slide relates to question number 1. Now, the Data Protection Act 1998 and the General Data Protection Regulation, which you may have heard of as the GDPR, which was brought in 2018, that protects everybody from having their information shared or misused. When you're working in health social care or children's care, everyone has a shared responsibility for safeguarding children and protecting vulnerable adults. We looked at that in part 1 of the safeguarding session, and confidentiality it's an important principle, and it allows people to feel safe in sharing their concerns and to ask for help. And this is where the GDPR and the Data Protection Act protects, because it, like I said before, you know, it protects everybody from having their information shared, but most importantly, misused. So you can share information if you have safeguarding concerns, but you have to share it with the right people and at the right time, obviously, you know, for good safeguarding practice. And after a disclosure, so for example, somebody telling you something, or an indicator, so we looked at signs and symptoms in the other session. So, you know, an indicator could be a bruise, And we did talk a bit about this as well, but you cannot promise the service user or the child that you're going to keep it secret or promise confidentiality, because you would need to share that information with the right people. You pass it on to the safeguarding team, no one else. You don't discuss it with your teammate or your friends. You discuss it with the relevant people in the safeguarding team, and you will get to find that information out, who that person or that team is, once you start working within that childcare setting, the health and safety setting, health and social care setting. Sorry, you will find out who that person is and what the procedures are. You need to treat the information on a need-to-know basis. So that means you can't tell people who don't need to know. So that brings me back to what I said before. You can't just say it to another team member, a colleague, your friend. You have to tell it to the relevant people. So this leads to question number 1. So you can pause this video here while you answer question number 1, and you need to describe the boundaries of confidentiality and when to share information. So think about the limitations of confidentiality and when you can and cannot keep things confidential. Think about what we've just talked about in the previous slide. Think about the scenarios, the case studies that you looked at in the first part of the safeguarding session, when you looked at Toby and Parvinder and those situations. Think about that. You need to describe, so ensure you write in sentences. Develop a paragraph of 3 to 4 sentences. Your sentences should flow and need to be structured correctly so that it makes sense. And like we've said in the past, start your answer with the question. So for example, the boundaries of confidentiality are, we can share information when. So, if you start your answer with the question, it's going to flow. And as I said, think about the previous slide and some of the things I've talked about and what the boundaries of confidentiality are, and thinking of that need to know and when you can share information. So we're now going to look at some slides relating to question number 2. And we're going to look at responsibilities for protecting vulnerable adults and safeguarding children. And I know we've talked about this before. Some of the questions, they do overlap, but it's important that you understand everybody working in health, social care, children and young people's services have a duty of care to protect vulnerable adults and to safeguard children. So like I said, as we've said before, when you're working in your environment, in your setting, you need to know what the procedures are, but you have a responsibility if you've got concerns. If somebody discloses information to you, or you spot, like we said before, you spot a bruise or something like that, it's important that you have a duty of care to actually follow your procedure and take this further. Protecting adults, vulnerable adults, and safeguarding children also involves you respecting their wishes, rights, and feelings. So that's important. Important that you respect their wishes, rights, and feelings. You must take all reasonable steps to prevent them from harm, abuse, or discrimination. So regardless of their age, their culture, their gender, disability, language, their racial origin, their religious belief, or sexual identity, as everyone has a right of protection. So, you might, somebody might say, well, this is something that's done, for example, in our culture, but if it's safeguarding, we need to do something about it. We need to act upon it and follow the procedures, start the ball rolling, and somebody would investigate that, and they would find out some more information. And just to finish off like we started, everybody's duty has a duty to report concerns of abuse, harm, or neglect. So we're going to look some more at responsibilities. Just to reiterate, everyone has a duty to protect children and vulnerable adults from abuse. And we're going to now look at partnership working and what that means. So for a few minutes, just have a think about what partnership working, what do you think partnership working means? And you'll see on this slide that partnership means working with others to get the best outcome for the individual, whether it be a child or a vulnerable adult. And you'll see on this slide also, we've got adult social care and childcare. So within adult social care, the people that would work in partnership, you've got care staff, you've got social workers, nurses, doctors, police, families, partners, friends, any other agencies the adult comes into contact with. So each adult that you're working with, they may have a number of these providers already working with them. They may have a social worker. They may have, they may have a nurse, the doctor. They will possibly have the families, the partners, the friends. So it's important that you work in partnership with all those people involved within that person's care. Over to the childcare. So there could be nursery staff, school staff, and the nursery and the school, depending on the age of the child, they may be in nursery or they may be of school age, so you're working with the school staff. Social workers again, a child and their family may have a social worker, doctors, the police, parents and carers, families, and again, any other agencies that the child comes into contact with. So the responsibilities for the partnership working and to safeguard. So safeguarding a vulnerable adult or children, it requires the organisations to work closely together in partnership, as we said earlier, to support and to safeguard them and, any of them that are at risk from abuse and neglect. Strong partnerships share the same goal to protect, safe and to safeguard the adults and the children. The partnerships have a good understanding of the partner's roles and responsibilities so they know where to turn to for help and advice. And safeguarding is about preventing abuse and promoting the well-being of vulnerable adults and children with their care and support needs. So working together within partnership with others will strengthen the care and support that the children and the vulnerable adults receive. So for example, if you were working with a child and there may be some safeguarding issues going on, it could be to do with the family, all these different organisations will try their best to work with the child and their family to try as best they can to keep their child within that family unit. That is the main aim. Years ago, you hear stories about, social services turning up in the night and taking children away. And, that can be very, very upsetting for a child as well. However, sometimes, sometimes that does have to happen depending on the safeguarding situation and what it is that's been investigated. But, a lot of the time they will try and keep children within that family unit to and to work alongside the family, and the same with vulnerable adults. They will work together and as we said, to get the best outcome for that person involved. So this leads to question number 2, and it's asking you to give examples of at least 3 professionals who are responsible for protecting vulnerable adults and safeguarding children. Next to each professional, you need to give an explanation of what their responsibilities are to protect adults or children. And you'll see here, there's an example. So the police service, so they are responsible to keep the public safe from danger. So pause the slide here, the video here, and answer your question. Number 2 within your book. So we're now going to look at organisations and what their role in safeguarding is. This relates to question number 3. Now, we've already talked quite a lot about when you start in your job role, whether it be in a nursery, a care home, working with in people's homes, you know, the organisation that you are employed by, we've talked quite a lot about them having policies and procedures in place, and they will have a safeguarding policy and procedure. And I also have talked about training. Now you're doing the short course with us, and we're touching on safeguarding training. So, you know, it's really important. However, when you start in your work role, you will be put on further safeguarding training, and it's something that needs to be updated all the time. There are changes that, you know, within the guidelines, so it's important that you know about the changes, and you'll be put on usually annual safeguarding training courses. So, you know, we'll run down the slide. So you have to have a valid and up-to-date safeguarding policy, which shows the staff how to report concerns and who to. It's really important that you know what to do. We've talked before about confidential information, who you can share it with. So it's important that you know what that policy and who you can share it with, who you do report it to. Have a designated safeguarding officer, often called the DCO for short. Again, providing staff with safeguarding training, as I said before, that's really important that you are provided with safeguarding training. Ensure staff have up-to-date DBS checks. We looked we talked a little bit about the DBS checks, I think in the first session, in the part 1 of the safeguarding, the disclosure and barring service, you know, so that again, all staff have to have up-to-date checks within that. And sometimes if you may start at one job and do your DBS check, you might have another job or change your job. And usually when you go to another job, or if you had, you know, you would have to do a new DBS check because obviously it needs to be up to date. Organisations have to recruit new staff who are suitable to work in the care setting. They have to make sure they've got the right amount of staff as well to the, you know, to the amount of people that are in the setting, whether it be a home care, childcare, nursery, a care home, you know, safeguarding. They need to have enough people and ratios of staff to adults and children. They need to make sure that the environment in the workplace is a positive one. So staff need to trust their managers. You know, if working in a positive environment, it makes everybody feel so much better. The people that you're caring for, the other team members, the staff members. And organisations also need to make sure the children or the vulnerable adults in their care are given choices. You know, just because somebody is vulnerable, or the children, you know, they are still able to make choices. Independence is a massive part. We'll look some more at independence as we look through the health and social care qualification, but you know, we need to support independence of individuals and let them have as much independence as they possibly can. Privacy and dignity and respect, again, we'll touch some more on that later on through the health and social care course, but you know, we need to make sure that individuals have got privacy. You know, we need to ensure their dignity, and we need to respect them as individuals for who they are. And you know, this prevents, wherever possible, we need to prevent institutional abuse from happening. And again, I think we've touched on institutional abuse. We will talk about it some more as we move along the sessions, but you know, institutional abuse is where we're not giving choices, we're not supporting independence, you know, we're actually just treating everybody the same, and we're not all the same. Everybody has different needs, so it's important that you know, organisations do give the choices. So this brings us to question number 3, and it's asking you to identify what organisations are responsible for in the protection of vulnerable adults and safeguard children. You need to give at least 4 examples, so 4 or more but no less, so at least 4 to identify. So you know, give the you need to first give the name of the organisation and then write a supporting sentence to show your understanding of what they can do to protect vulnerable adults and safeguard children. So you need to pause the video here and answer question 3 in your workbook. So we're now going to look at who may need support, and this relates to question number 4. So within safeguarding, as I said at the beginning of this presentation, if you needed any support, because safeguarding is really not a nice topic to be thinking and looking at, however, as we've seen, it's really important. We need to know about it. And I said to you at the beginning, we've got our own safeguarding officer, and we've also got, various organisations that we could put you in contact with. And this is just the same, for people who are working in that care sector. So the people who might require support could be the person making the disclosure, so the vulnerable person or the child. So if they're telling you something, disclosing some information that gives you concerns that needs to be acted upon, taken further, they will need support. The person listening to the disclosure, so it could be the care worker, the nursery staff worker, the school staff, you would need support if you're the person that they're telling you the disclosure to. And also the person responsible for safeguarding at the place of work and the line manager. So through all of those people would need support. And like I said, it is part of your duty of care. You have a responsibility to report and prevent harm, abuse or neglect. But please don't forget, look after yourself. It can be a lot to take on if you are involved in a safeguarding situation, and you do need to look after yourself and talk to people, the right people, obviously not just like we've said before, share it with the right people. But if it's affecting you during or after, you still need to look after yourself and use the support services that are out there. So where can we access this support? So you will see on this slide there is a list of organisations. So you've got the National Society for Prevention of Cruelty to Children, which is often known as the NSPCC, Action on Elder Abuse, Age UK, Adult or Children's Social Care, Elder Abuse, Mind UK, MenCap, Save the Children and Barnardo's. And what I suggest you do now is you have a look at these organisations and you find out a little bit more about what support they offer. Find out about them, what they are and what support they offer. And this leads to question number 4. So it's asking you to identify at least 5 sources of support and information in relation to protection and safeguarding. Okay, so the slide before, the research that you've done, out of those you can choose 5 from there, or you can look for some more of your own examples. If you might know of other sources of support already out there. And it's just, you need to give the first name of the source and then write a supporting sentence to show your understanding of what they can do to protect vulnerable adults and safeguard children. And that's the end of this session. And we'll just run through the aims and objectives. So now you've finished the session, you should be able to describe the boundaries of confidentiality and when to share information. You should be able to explain who is responsible for protecting vulnerable adults and safeguarding children. And you should be able to identify sources of support and information in relation to the protection and safeguarding.